Welcome back to the Physical Therapy San Pedro podcast. This is episode 52, and today we are moving into our thoracic spine series, starting with our first topic, which is upper cross syndrome. I am your host, Dr. Janae Brown, and I am joined by my two wonderful physical therapy team members with me. So to my left is
Dr. Silverton Wynn.
And to my right,
Dr. Bay.
I almost tripped up on that because I was like, it's the physical therapy team. We don't have anybody else in
Thank
here.
goodness you mentioned how wonderful we are.
Yeah, that part is important. Got to always give the good adjectives, right? So we are in a new setting here. We're in our new location, and we're recording our podcast from a new spot. So we hope you guys enjoy this. We're trying it out, so we'll see how it goes and if we stick with it. This blog was written by Dr. Silverton. And so since we're in our T-Spine series, normally what we do is we all pick a topic that we feel is important to us or that we want to talk about or share and educate about. So he picked this one. So Dr. Silverton, tell us, why is it that you chose upper cross syndrome?
It's a constellation of symptoms that we see on a regular basis, especially in our society where we're more sedentary, whether we're sitting, driving, on the computer, working from home, where we find ourselves down here a lot. Not to say that you should never slouch. It's just that you should be able to get out of that position also and just be aware that if it does bring on any sort of symptoms, then you can do something about it. And it's something I see on a regular basis where I have to sometimes point it out to people in order to manage their symptoms, as well as I use it as a way to affect other things when they have pain in the neck, the shoulder, the back, difficulty breathing, things like that.
Yeah. So we see it a lot. We see this a lot in our practice. I don't think there's many PTs that don't have someone come in their office and not have this particular problem. And the other part is it's with some work, right? It's fixable. It's like something that we see some good success on. So we're going to give you guys all the information about upper cross syndrome. I'm going to start by talking about what it is and how the symptoms of upper cross syndrome develop. And then Dr. Bay will take us into some of the symptoms, and Dr. Silverton will close us with some rehab stuff. So what is upper cross syndrome? Dr. Silverton talked a little about to start, but basically it's when we have muscle imbalance in the body. We have muscles that are typically more short and overworked. And then we have other muscles in the body that are underused and weak. So, and typically it follows a pattern of, we used to think it was like front of the body, back of the body, but it's more just muscles that we tend to utilize more in the postures that we develop. So the muscles that we see that are often shorter and overworked are our upper trapezius muscle. So that's this one up here. Everybody knows that shoulder shrugger, right? Our levator scapula muscle, which kind of goes along and lines up with the upper trap muscle and goes from the neck to the shoulder blade. Our pecs, our pec major, which is right here, our chest, our big muscle on our pec and our small muscle on our pec. So they go like this together. So those are their typical short muscles that we're using a lot, and they take us sort of into this sort of a posture. And then our weak muscles, which are underused, are typically our deep neck flexors. So those are the muscles on the front of the neck. So if you're sitting like this and like that, these are going to just be a little bit overstretched and weak, not being used a lot. Our rhomboids, which are in the middle of our shoulder blades, right in the middle of our shoulder blades, and those bring the shoulder blades together. So if you're like this, they're being overstretched. Our lower trapezius muscle, which is the lower part of the upper trap. It's very interesting because this is one large muscle, but it's the bottom of it and also between the shoulder blades, but lower. And so that particular muscle depresses or brings down the scapula. But if you're in this position, then it's the shoulder blades are coming off the spine. So it's being overstretched and weak. And then our serratus anterior muscle, which is a large muscle that comes around the rib cage, kind of like this. And those muscles are really important in breathing, really important in punching, pushing, pulling. So that particular muscle gets overstretched as well. So, and how do we get it? We get it from typically staying in poor postures for a long time, right? So all of us sit, right? All of us, some of us sit more than others. We are very blessed and lucky that we do not have like jobs that require us to sit a lot. You know, we're not sitting at a desk all day. We're up, we're moving around. It's a good thing. Yeah.
But I find the fact that I lean forward a lot when I'm working manually on people
Yeah.
to make me susceptible.
Yeah, it can, because you
Yeah.
still have to think about it, right? So, for example, if you're sitting in a chair all day at work and you're like this, you're gonna be in a relaxed position, and it's not that that is a bad thing, but it is a bad thing if you stay in that position for long periods of time. Our body in general does not like to be in any position for a long period of time. So if you were like that for maybe 30 minutes to an hour and you got up and you went to the bathroom, got some water, came back, you'd reset. And then when you got tired, you kind of go back in that position. That's okay. But if you're sitting there for 4 hours, then what happens is over time, you just start to develop a posture where the certain muscles, those certain muscles are just overworking and the other ones are just getting stretched out. And that's where we kind of can have a problem. So sitting for long periods. But we have people who are in professions like orthodontists who they're not necessarily, they're leaning forward and they're in certain positions that take them, similar to what you're saying, we have to be careful as certain professions where we're doing certain things, even surgeons, you're put in a posture where it might take you into position for a long time. But Dr. Bay, you're not there for 4 hours. You're there for like
So glad.
5 minutes. Yeah, maybe 10. So it's really the time, the time constraint that, in those positions that matters a lot. Tech neck, all of us are on our devices, right? Looking down, or we're in our bed and we're up against the wall and we're doing this, we're looking down, we're in positions for long periods of time that put us in poor postures. So another consideration, how long are you in that position? And is it good for your body for a long period of time? Again, we can do things for short periods. It's all about doing it for a long period of time. And then just lack of movement, not moving a lot, not moving enough, not moving your body. The body wants to move. It loves to move. So if you're not moving, that could be problematic as well. So, yeah, over time, these bad habits will lead to upper cross syndrome. So that's my portion. And I have a pretty picture on our blog of what this looks like in the big scheme of things. Did I miss anything? Do you guys have anything to add about what it is or how it develops? Thoughts?
No, I would just say that I have a lot of conversations with my patients about how we can sit, the positions that are allowed, right?
Yeah.
Like don't cross your legs. That can makes even more spine movement happen.
Yeah.
Or don't sit with your legs outstretched for long periods. All those are even worse than desk sitting.
Yeah. And I think too, like there's been a big conversation within our profession about posture. Like, so we always have to be careful when there's like these controversial topics. This is kind of one of them. That posture always leads to pain, or that, that you can't have bad posture. I think ultimately we just need to think about function. I mean, even if you don't have pain and you have upper cross syndrome and you have a bad postures, ultimately your function is going to be limited. If you can't, if you are in this position and over time you stay there and your postures, your body ends up staying there meaning you get into that fixed posture. It's like you can't get out of that posture. Then you're going to have limited shoulder mobility. Like, so going up into a cabinet or even overhead pressing, your body is going to eventually not be able to do certain things because your posture becomes fixed over time. So, we want people to be able to move well and feel good. And so ultimately that is the reason why we feel like this is a really important topic to kind of discuss and help people with. So, yeah.
The way I normally explain it to a lot of patients is that gravity takes over. So it just follows the curvature of our spines, that our chest is going to come down, our shoulders are going to roll forward, our head's going to kind of droop forward into the more of that cervical lordosis. And it's comfortable. You don't have to use muscles or anything like that. It just kind of hang on your ligaments. And that's fine. Just if you start having issues with it, then you might want to recognize that that's part of the issue. And if you can change your position and get out of it, then cool. You don't have to see us. That's great. More power to you. But if you do have issues as far as fighting gravity, basically, then figure out what to do about that. And we can help you with that.
Yeah. So Dr. Bay is going to take us into the symptoms of upper cross syndrome. There are some specific things that we see as a result of this problem. So tell us what those are, what some symptoms are that you might have this.
Yes, some common symptoms that people report with upper cross syndrome are neck and shoulder pain, headaches, round shoulders and forward head posture, limited range of motion, muscle weakness or fatigue, numbness or tingling, and pain that radiates. So, one of the key postural issues that we've been discussing is called thoracic kyphosis, and in upper cross syndrome, that's accentuated past normal. So, we would call this excessive thoracic kyphosis. So, this curvature, when it's exacerbated, or sorry, more than normal, it reduces the ability for other areas to move, as Dr. Brown was touching on. So, what we have to understand is if we're moving our neck, if we're moving our arms, if we're moving our spine and hips, there is an element where our middle back, the thoracic spine, that area encompassed by the rib cage, that should also have the ability to move. So if we're in that fixed position and it cannot move, it starts to affect all these other regions of our body, causing them more and more stress. And that's when pain in the upper body tends to develop. So to review how the thoracic kyphosis, when it's increased into that excessive amount, how it affects us is in our neck. If we're have extra rounding in our upper back, we are going to be in general limited in our ability to especially look up. A common test I do with my patients is I have them look up and they're like, oh, it hurts, and they tell me where. And then I say, okay, now let's sit up straight. And then we look up again, they go so much farther, and then they tend to have much reduced symptoms. And they go, oh, that's so interesting. That motivates me to want to change my positioning or straighten up more often. That's so cool, right? The next one is shoulders. Dr. Brown also touched on this one, pressing things and reaching overhead. If our upper back cannot flatten out or extend, we cannot get our arms completely overhead. They'll be relatively stuck here. You'll be at your end shoulder range, but you actually can get so much farther if you straighten up. The next one is the lower back. When the thoracic spine doesn't move, the lower back tends to overwork to make up for what the thoracic spine is not doing. So, what we can also expect to see symptom-wise is that when we evaluate people, we're going to see lots of muscle imbalances because of this. We're going to see that because of this, posture gets worse and worse eventually if it's not addressed, if we're not coming out of this position enough. And lastly, that we're going to have tension and discomfort throughout the entire upper body. It can present in many ways. It can be the nervous system is placed on too much tension and you're going to get pain localized in the spine or radiating out into the arms or legs even. The muscles in the spine and upper back can be extra painful. So these things unaddressed definitely lead to pain and discomfort developing. So the better you can start to address this, you're going to be restoring your function that much more.
Good stuff. Very thorough. Thank you. So does anybody have any patients that have this problem right now that you're actually treating for?
Yes.
You do? Yeah. And would you say of the symptoms that are on that list, you see consistently more than others, like with these patients, or is it kind of like everybody presents with something different? Or would you say they all have these things? Like, I know if I see these things, this is certainly this problem.
Yeah. So I see it on both ends, and they trend to have for my patient population, I've seen symptoms more concentrated in either the upper body or the lower body. So the person I'm thinking of at this moment, she has a job where she has to sit, and I believe she sits in a truck because she's a longshoreman and she's, looking for things and working on her computer in her car. So she has constant neck symptoms like muscle tension pain. We find that those muscles overwork, the ones you described in our anatomy lesson, and that she has a lack of flexibility in her neck. We also see that she can't get her arms overhead. So she's trying to do the right thing and she goes to a personal trainer, but she hasn't addressed the upper cross syndrome. So even though she's strength training, she still is in the poor posture while she's strength training. So she hasn't been able to make much success on her own. And that's what brought her to us.
Yeah, it's good. It's good. Yeah. What about you, Dr. Silverton? Anything?
Yeah, most people don't actually will have the pain into their upper back region specifically. A lot of times they'll present with neck pain, shoulder pain, low back pain. So I actually use that as a point of opportunity if I can't go after the neck or shoulder right away because it's too aggravated. Case in point, I just evaluated a gentleman yesterday who just had a labral repair,
Mm.
his second one, and there's as far as post-op rehabilitation of that, there's limitations as far as how much range of motion you're supposed to do by what time. So I go for other low-hanging fruit that I can help him out with. He complains about neck pain at the same time. He complains about low back pain, just chronic sort of thing. So knowing that he's in that kyphotic thoracic position and it's stiff through there, I know that, okay, down the line, that's probably what contributed to the shoulder issues in the first place that he's had chronically. So I'll go after the thoracic spine and start working on that early on because I'm just limited on what I can do with the shoulder. So that'll be my strategy as far as helping him get more upright. And then as we can do more and more of the shoulder, then it just flows real nicely into it and it alleviates a lot of the overhead reaching issues that he'll eventually have anyways. So as he starts getting to that point in his post-op rehab.
Yeah. One of the things you said that really triggered in my mind is the fact that I'm going to think about it, but I don't think I've ever had a prescription with this diagnosis on it, because what happens is our prescriptions say neck pain, shoulder pain, back pain, right? So we get, or rotator cuff strain, like most of a lot of our patients that have these problems have this condition, and we don't really think about it as PTs too much, but we're really treating the upper cross syndrome. Like we're dealing with
the time.
We're dealing with the pec because we're working all these muscles around the area because we see that there's a weakness in one area and there's a muscle imbalance. So we need to figure that out, and we know that ultimately that's going to help this issue, right? But that's something that I think people don't really see. You might not go to your physician if you're having pain and they say, oh, you have upper cross syndrome. They might say, oh, you're having neck pain. Okay, here's a prescription for neck pain, goes to your PT. Then we do a thorough evaluation and we go, okay, this is something that is, we need to deal with this. Yeah. Otherwise we're going to not really fix the long-term solution, right?
Yeah. Commonly we see posture on the diagnosis, but after the big pain one.
Yeah.
It's like, and also posture. Work on their posture.
Yeah. Poor posture, postural instability, something like that. Yeah. Yeah. Any other thoughts on that, guys?
It's all the moving parts that are involved.
Yeah.
It's not just typically shoulder pain. Yes, the pain is in the shoulder for the most part, most of the time. But what gets your arm overhead or what's involved in the thing that they want to be able to do, pushing, pulling, lifting, carrying, daily life stuff, it involves more than just the glenohumeral joint, more than just the shoulder joint itself. You got to use other parts of you. So we have to expand our viewpoint in order to take those parts into consideration. In the rehab terminology for that is regional interdependence, where we have to consider those parts in order to help the part that actually hurts, and then just offload the thing that hurts for the time being to let it calm down, and then we can work on the other things.
Right. And when it gets really bad, we're dealing with a thoracic outlet syndrome, which is, I think, probably the most exacerbated form of probably this problem, because we're dealing now with cutting off, blood flow and nerve supply and things like that, and really creating something that is really impacting the patient. And that usually those patients are ones that end up either as candidates for neck surgery or some sort of thoracic outlet surgery, opening that area or whatever. But I have seen huge success with PT just addressing this stuff and getting someone out of that problem. So hopefully you're not in that place and you're not that far. Our goal is to educate you and help you see the light before you get to the end of the darkness where you need a lot of help. But but that is one thing that we end up seeing when something is really bad, is this turns into that. Okay, let's talk about PT. Let's talk about the benefits of physical therapy for treating upper cross syndrome because we see it a lot. So why would why would someone come to PT for this?
We typically, or at least most physical therapists, will try to look for what's the biggest bang for our buck. On day one, patients are coming in, they say, "Oh, their doctor just sent me to physical therapy. They gave me medications. Just been taking that. So, what are you guys going to help me with?"
Mhm.
So the first thing I always try to find is what's the biggest bang for our buck? What's going to alleviate the most amount of pain first day one, and what's going to calm it down? And that kind of takes a fairly detailed assessment, and looking at what makes them tick, what their aggravating factors are, and what can we do at that time, or what can that patient do at that time in order to get it to start calming down.
Mhm.
So that's typically day one for me. If they're coming in here, they typically have pain. So if we can do anything that decreases that pain, just manage the symptoms, change the way they do things, so that way they can, if we can, let them keep doing the things they want to be able to do, just with a little tweak here and there, then great. Keep doing what you want to be able to do, so long as it's not aggravating the symptoms. Um, and I'll have that conversation with people as far as, okay, is this a good idea for you to continue doing? Maybe with some caveats, maybe with some changes, or do we need to pull you back from that? So, and I'm the last person that wants to take things away from people, especially if it's something that they enjoy doing or they have to do, like work or feeding the kids or something like that.
No one wants to work. Just kidding.
Yeah.
Just kidding.
we,
Well,
we,
some of
we,
us
we,
we love work,
we like buying nice
right?
things.
Okay.
But keeping people moving is our job.
Yeah.
So if we can find way, and typically what we find is, so long as people keep moving in relatively pain-free ways, then that's probably for the best. And then if we need to take things away as far as, okay, you just are doing way too much, then we'll start removing that. And those are conversations that I'll typically have with patients on the very first day. Um, a lot of that time comes down to if they're telling me that they're having this pain only when they're sitting for long periods of time. It's like, okay, show me what you look like when you're sitting at your desk. Had a gentleman the other day who said that he gets this left upper abdominal pain
Hmm.
for some reason. He's been having it for, I think, I can't remember, months to years. GI, he saw a gastrointestinal doctor, consulted, and like all clear as far as stomach sort of things.
Mm.
And I was like, okay, that's good. I don't have to worry about any sort of abdominal sort of stuff. So we sent him to PT and try to figure it out. And he says that, yeah, it hurts when I lean on my desk like this and I'm on the computer for about 4 hours straight. He's like, okay. So I
Wow.
poke around and it's like, yeah, he's sore right around along his intercostals, along his serratus, and it reproduces his symptoms. I'm like, okay, can you just take that arm off? Just
Don't
sit back.
don't sit like that.
Use the lumbar support. Bring that elbow rest up a little bit.
Yeah.
And he's like, okay, I'll give that a shot, and we'll see what happens with that guy. But I think I made a point where it's like,
Well,
okay,
you're never going to see him
change it.
again because he's going to be cured.
Quite,
Yeah, right.
I don't know. Sometimes it does happen that way,
Yeah, yeah.
and I'm okay with that. If it's just as simple as that, then
Right.
I'm fine with picking the low hanging fruits.
Yeah.
On day one, and if it makes a big difference when he gets him back to doing stuff, then great.
Yeah.
More power to them.
Good. So day one's about education.
Yeah.
I mean, the big hit home is on day one. What are you doing that could be creating this problem? And can we do something really quickly to fix it? And what can you do? What can't you do? I think that's huge because we're huge educators and we want to help you guys right away. And you're here like 1 hour, twice or 3 times a week, and you're not here the rest of the hours of the week. So, yeah.
And to reinforce the behaviors, if it requires sitting back, getting out of that position, okay, you can do that. You can use the lumbar supports. You have all these ergonomic sort of things that addresses the posture, and that's a good that's a good quick fix, typically for the most part. But then we can reinforce that with use the muscles that actually do those things that all your nice ergonomic things do for you. We're not meant to sit for that long a period of time anyways, so hence why it's nice to have ergonomic supports and everything like that. But are you getting out of those positions once you get away from your desk? And do you know how to actually use those other muscles also? Or are you just still stuck down here, even when you're washing dishes or you're just walking around the grocery store? I'll typically prescribe exercises for them that take them from here to out here, and get that chest up, get that thoracic extension, um, and try to teach them those kind of skills, and reinforce those muscles so that way they can fight gravity, and not have the world literally dragging down on their necks and shoulders.
Yeah.
And that's typically the long term solution also.
Yeah. It's good. I'm thinking about my posture right now as I'm sitting here because we've been here for about 25 minutes and I'm going, I don't have back
It's
support.
time for one of your exercise snaps.
I know.
Dr.
Now
Brown.
we need to, yeah, exactly. We need to stand up and do something. But it's funny because I think what happens is a lot of times, so I feel my body telling me you need to change position, right? But we ignore that. So what happens is your body's smart. It tells you what to do. It tells you it's not happy. It says stop, but we ignore it and then we have problems. So the key is not to ignore that, to listen to it, to get up and move, to change your position, to do what you need to do so that you don't have problems, right?
Yeah.
So day one, we educate. Day one, are you doing any manual therapy? Are you doing anything hands-on with patients? Do you do, if you are you doing that with every patient? What are some other things you might implement in terms of the physical therapy plan with someone that has upper cross syndrome? And then you talked about exercises, so giving them a good home program, things like that. Is there anything else you would do?
Yeah, manual therapy is a cornerstone of what I do. I just got trained a lot on it and I'm fairly good at it. So I find it very useful as far as just testing things also. So I'll just do a trial treatment. So if during my assessment I find that, yeah, your back does not flatten out whatsoever, like I can try to force it and it doesn't move. I will force it. I'll try to stretch them out. Try to get them
Jump
moving.
on it.
Yeah,
Grade
exactly.
5.
Yeah,
Just kidding.
exactly. Whatever
You will move.
we have ways of making you move.
Right.
So I'll do that and then I'll just do a test retest like, hey, my arm hurts when I lift my arm over my head. Okay, cool. Show me how high you can get. And does that hurt? Yes. 0 to 10, whatever. It's like, okay, lift my arm up. That's a 5 right there. Okay. Do a quick thoracic move or a manip or anything like that. Or even with the exercises, if the exercise I find that the exercise might be sufficient, then I'll try that. Have them try it again. Hey, my arm goes higher. Cool. Does it hurt as much? No, it's like more like a 3 now. Cool. Keep doing that.
Yeah.
And so it's good for buy-in. And it's also gives me the confidence that, hey, I'm on the right track.
Yeah.
And so a lot of the exercises will be based on that type of assessment and trial treatments to see if we're going in the right direction. And then
So
sometimes if they do move great, then I might change my treatment hypothesis. And then I might just be more, okay, maybe they're just really loosey-goosey, and that's great, but they just don't have the strength for it. Then it's not so much of the manual therapy that they need, they just need more of the strengthening.
right. Yeah. So you're doing some manual therapy, which for you could be some soft tissue, or it could be some joint mobilization. It might be a high grade 5 something. Basically, if your body's not moving, we want to help it move. So we'll use our hands, we'll use our brains to move your joints around. Then we'll teach you some things that you are going to do to continue that work. And we come back and revisit it and we go back and forth. Do you do anything else in terms of modalities? Cupping? Do you do any stem, blood flow restriction? Either one of you? Do you want to weigh in here?
Sure. I mean, very similar to Dr. Silverton. I'm really big on my assessment signs and testing throughout my treatment to see if we're heading in the right direction, hopefully. But yeah, day one, I'm definitely trying to see if we can help them get into an improved posture and activate those muscles that have been weakened. And day one, I definitely would not do blood flow restriction. I want to learn more about the person before I apply that modality.
In general, in your treatment, though,
At day one, I am discussing with them, like, based on what I see and personality wise, I'm examining, my practice. I do like to cut people. I do like to try to enhance your strength gains with blood flow restriction training. Are you open to those possibilities, or getting parental consent if that's required?
Yeah.
So that I can layer those on in the follow-up treatments once their home program's looking really good and I have an idea of which exercises would go well with those modalities.
So you're using that in your treatment. Yep. So the long-term solution is, for the problem not to come back? Do you guys feel like this is something we can fix if someone had upper cross syndrome, is this something we can fix in a 3-month period, in a 2-month period, in a 1-month period? Tell me, let's be realistic. Is that something that you guys would say would want to see over time? So weigh in on there on your thoughts. And it could be patient by patient, right? Some people are young and start to develop a new part of this, and they're not in fixed postures yet. And then we have people who are in fixed posture. So anyone weigh in on that? Like, if you had someone who came in and they had pretty poor posture, you saw them in this situation, they were maybe in their mid 40s, 50s. Are you going to fix that in 3 months?
My goals are typically just generally more about like, okay, they need to be able to sit for at least 1 hour in class, or they need to be able to lift something above their head. So that's typically more the goal and the emphasis. I'm not really treating the upper cross. It's more of a model that I'm using. I'm seeing that. I can see it. It's like, okay, we don't have great measures as far as like how much of an upper cross syndrome somebody has,
Right.
but we do use it as a treatment model. So it's always going to be dependent upon what that patient wants, what their goals are, what they need. And then as far as when my approach for it, I know that their thoracic mobility needs to improve. And even then, we don't have great measures for thoracic mobility. So it'll still come down to, okay, does your arm go up higher today? Are you able to lift your kids up without it hurting as much? Can you look over your shoulder further without it bothering your neck when you try to check your blind spot? And so a lot of the times it's based on that. As far as how long that treatment may take, it depends on person to person. Like the longer they've been having the symptoms, if they've been having this neck pain going down their arm for 2 years, your duration is probably going to be a little bit longer because we gotta put some fires out before we
Yeah, right.
before we get too deep into it.
Yeah. So the short answer is it could take if it's something where you have we would classify like a severe postural deficits or whatever, right? Or a severe upper cross.
Yeah.
You're working through this over time, right? Yeah.
Yeah. And it's something you would continue to revisit even after you're discharged from PT.
Yeah.
Because we want you to not revert back to your old ways and to keep moving forward. But yeah, someone with that like nerve damage going on or radicular symptoms, I think 3 months is a very reasonable time period. It takes about 4 to 6 weeks for our muscles that we're trying to strengthen to correct the imbalance to start to grow. So if someone's pretty diligent with complying to their treatment plan and respond well to the things that we're giving them, that would be very reasonable.
Okay. So what are some DIY tips for let's send our listeners off, those tuning in, with some things that they can do on their own at home. So give us some quick fix tips for home.
Some very general advice would be to stretch the shortened muscles. So if you look at that picture that we have on the first page of our blog, you can try stretching out those muscles to see if it helps alleviate some of your symptoms. Don't hurt yourself in the process. Strengthening the weak muscles is always a good idea. Again, it's going to be based on if you can or not. If you're not sure how, you can ask us. Being mindful of posture, taking breaks, and working on thoracic mobility.
All right. So stretch the short muscles, strengthen the weak muscles, be mindful of your posture, take breaks, which I need soon because I feel it, and work on your thoracic mobility. Keep moving, right? Keep moving that body. It's the easy one. Don't stop moving, right?
Yeah.
Cool. Do you guys have any final thoughts before we end that you want to share with our listeners?
No, just address it before it gets bad.
Yeah, it's true.
It can really change how long it lasts and how much it will impact you. These are some easy things to practice in the grand scheme.
Yep. Yeah, if you're concerned about your posture or you're having what sounds like upper cross syndrome or you're having neck pain, shoulder pain, anything like that, get some help. We would love to help you if you're in the San Pedro area, or we also do telehealth services as well. So if you need help, we would love to help you. You can reach us and send us a message or contact us through our website. You can find us on Instagram and Facebook at Physical Therapy San Pedro. We have this podcast, which is on Apple, Spotify, Amazon Music, so you can listen in there and get some information and contact us via that, or YouTube. We have all these videos. We have 51 episodes prior to this that you can tune into and learn from. And so tune into what we're sharing. We want to share great, valuable information for you guys, and we want to help you. So we also have some online programming that we've started. So we have an ankle pain program, and we're releasing our knee pain program soon. So if you want to do a program from home, those are things we're developing that you guys can tune into as well. So thank you guys for tuning in. We are coming back for episode 53 with, are we doing rib sprain? Is that what it is? Dr. Bay will be doing that. So stay tuned, because if you have a rib sprain or you're concerned about it, she's going to give you all of the sauce. Okay. We'll see you guys next time. Bye.